Lovers, today you're welcome. Thank you for subscribing to our YouTube channel. Today we're going to educate you people on tuberculosis. Okay, thank you wherever you're joining us from. Thank you. Tuberculosis, it's one of those infectious diseases that should be given an urgent attention. Why? Because it's very deadly. Okay, now this tuberculosis actually affects the lungs, right? It affects the lungs and it can be spread through the air. Okay, it can be spread through the air and it affects the lung. And you'll not find out that most people who are having tuberculosis are the people who may have coughed for a long-standing cough, more than 8 weeks, and some of them can be associated with blood. Okay, now last time we talked about how to sneeze and how to go about sneezing. When you're sneezing, that you shouldn't sneeze into your hand, rather you sneeze into your elbow, because when you sneeze into your hand, you can have a handshake with other people, thereby transmitting this microorganism or bacterial agent to another person. Okay, so for you to avoid this, you must try to look out for those people who are coughing in the society. Okay, people who have coughed for more than 8 weeks and above. All right, what they call chronic cough. All right, and when they cough they cough out blood. In some occasions, some of them cough out blood. All right, and for you to avoid spread of this sickness, infectious disease, you must avoid sharing any object with them. People who are coughing can have, they want to take tea, they have cup, and that cup is being shared with other people in the house. You should avoid it because it's a means of contacting it. Okay, when they sneeze, they should wear a protective mechanism like the mask, so that they don't have to drop the bacterial agent into the air. There another person will pick it. Okay, and when they finish sneezing, if they make mistake by sneezing into their hand, they should wash their hand with with soap and water or alcohol base. Okay, this will be able to eradicate or kill this bacterial agent. Okay, in the year 2023, it was said that about 10.8 million people were infected with tuberculosis worldwide, and about 1.2 million people died out of it. So you can see how bad it is. Okay, so these are things we should look out for in our community. And whenever these people have been, now there are a lot of risk factors that are associated with this. People who their immune system are weakened, people who are having a harmful use of alcohol, people who are diabetic mellitus, people who have AIDS. All these people have a tendency of developing tuberculosis. Okay, and now there are other things that are associated. When you notice people that are coughing and they've lost weight, they are weak, they are always having a recurrent fever, and they sweat profusely. When you sweat profusely at night, you should be thinking towards something going on, especially when there is cough. You should know that this person is likely to have tuberculosis. Okay, so it's a curable disease. It's a curable infectious disease that, when it's given a good attention, it can be cured. So why not tell these people to go to a health facility where they will do some investigation that will tell them that if they're having tuberculosis or not, and afterwards they give them medications. So these are what we should do to encourage our society to make sure that most of those infectious agents or most of those infectious diseases are being curtailed. Thank you for always subscribing to our YouTube channel, Dr. Doni TV. Thank you, because we're going to bring more of this health tip to you, so that you know what to do in your local region. Thank you. Remain blessed. Bye. Have a lovely day.